Hello, Harrison Bone here for Cervicogenic and today we're just talking about one of the latest blog posts we spoke about in terms of how prevalent really is dizziness following a mild traumatic brain injury, also known as whiplash or concussion. Interesting, we looked at Galileo's work in 2019, and basically they took a outcome measure and handed it to patients. Did three different groups. You had a symptomatic group, you had an asymptomatic group, and then the healthy group. And outcome measures are used in the physical therapy world to detect functional impairments, basically. And in particular, for this post, we talked about the Neck Disability Index and the Dizziness Handicap Inventory. And these are two very common ones that we'll speak about in the terms of cervicogenic dizziness because it relates both to dizziness and neck pain. So interesting enough that they found that over half, really, of these people just in the self-report measures had some sort of dizziness association with symptoms, and 79%, almost 8 out of 10, really has some sort of neck pain and disability. And this is just handing them a piece of paper, and just kind of asking them what's going on. And we really talk about in the blog that we probably could miss some of these people that may have some underlying disturbances if we just ask them. And because when they looked at the asymptomatic group, a huge percentage of these people actually showed some clinically relevant changes or dysfunctions on these outcome measures. And that didn't even include what we might do from a physical examination standpoint of getting in there and assessing joint mobility, assessing cervical muscle fatigue, looking at potentially joint position error testing, things of that nature that can kind of help you determine if it's truly something going on that may be a reason why they're still symptomatic. So really the conclusion we want to get from this study, and it's really well written, is that we do recommend, first and foremost, just don't ask somebody, hey, you have any dizziness? Because there may be other things going on, or that they may say, well, this isn't important, I'm having all these other issues. So these self-report measures can be useful in that, is that the person is sitting there writing it down and checking off the boxes, and it probably gets them thinking a little bit more. But we also want to make sure that we just don't do that as well, because even if we do, some people may not even elicit some symptoms that we can go after through a manual and physical examination. That's just a standard practice. It sort of seems like it gets lost in today's world of simply getting in there and getting your hands dirty and just seeing what's going on, making a clinically reasoned decision based off your examination findings. So I hope you enjoy this and hope you come back for more. Thank you.